Healthy teeth play an important role in daily comfort and overall oral function. A natural smile reflects strong, aligned teeth working together effectively. Teeth allow smooth chewing, helping break down food efficiently. Proper jaw alignment supports balanced pressure during every bite. Strong enamel protects teeth and maintains their structure over time. Healthy teeth contribute to confidence and a comfortable lifestyle. Over time, a tooth may become damaged due to various factors. If untreated, the damage can gradually weaken the tooth structure. In some cases, the tooth may be lost, leaving an empty space. This gap can affect both appearance and function. The surrounding teeth may begin to experience uneven pressure. Chewing can become difficult and less efficient. Adjacent teeth may slowly shift toward the empty space. The jawbone in that area may begin to change over time. These changes can impact daily comfort and confidence. A dental visit helps identify the exact condition. The dentist carefully examines the affected area. The missing tooth space is evaluated in detail. Advanced imaging provides a clear internal view. A 3D model helps visualize the structure of the jaw. Bone quality and strength are assessed carefully. A precise treatment plan is created. The dentist explains the available options clearly. A dental implant is introduced as a reliable solution. The patient prepares for the procedure with confidence. The process begins in a clean and controlled environment. The implant site is carefully prepared. The implant is positioned with precision. It is gently placed into the jawbone. The implant forms a stable base within the bone. The implant remains firmly in position. It maintains close contact with the surrounding bone. The integration process begins naturally. The implant becomes securely anchored over time. Its position remains balanced and stable. A healing cap is placed to support the process. The surrounding tissue begins to settle. The area remains clean and stable during healing. The implant gains strong internal support. It becomes ready for the next stage. Bone integration reaches a strong and stable level. The implant is now fully supported by the bone. The gum tissue appears smooth and healthy. The healing cap is gently removed. The implant is now clearly visible and prepared. An abutment is placed to connect the final crown. The connector aligns perfectly with the implant. The structure is now ready for crown placement. A custom crown is prepared to match natural teeth. The crown is aligned carefully above the implant. The crown begins to move into position. It is gently seated onto the abutment. The crown fits securely in place. It aligns naturally with surrounding teeth. A bite test ensures proper contact. Pressure is distributed evenly across all teeth. Chewing motion becomes smooth again. The full dental system works together naturally. The implant provides strong internal support. The restored tooth looks natural and complete. The smile appears confident and balanced. Facial expression becomes relaxed and natural. Eating becomes comfortable and effortless. The bite remains stable and aligned. Daily activities feel normal again. Confidence returns in everyday movement. The body feels relaxed and at ease. All teeth appear healthy and uniform. The implant remains fully integrated internally. The structure stays strong and stable. Chewing continues smoothly and consistently. Jaw movement remains balanced and natural. The entire system functions efficiently together. The process concludes with a clean and calm transition. Dental implants restore both function and confidence.